Hello there. Nice to meet you. I am Nurse Gibi. I will be performing a couple of tests for you while we wait for the doctor to come in for your eye exam. Yeah, so you can sit right there, have a seat, stay comfortable. And have I seen you in here before? No, you're new. Okay, that's what I thought. I don't recognize you. And I have a pretty good eye for faces. So, if you don't mind, can I get a few bits of information from you before we begin? Fantastic. So, I'm going to write these down on my paper, and then later they'll be transferred to our computer system. So the next time you come in, we won't have to ask you the same questions. Wonderful. All right. So we'll start off with your name. First name and your last name. How do you spell? Okay, gotcha. All right. Now all seems to be in order. You're right on time for your appointment, but we like to make sure we have the correct people in the correct room. Exactly. And your date of birth. Month, day, and year. Yeah. Fantastic. Okay. Can I get your mailing address, please? And the town for that, okay? The zip code is... Okay. Thank you. We'll be sending you bills, but if you prefer paperless, we can sign you up for that as well if we get your email. Okay. Your last name. Okay. Thank you. All right, perfect. Well, then I will sign you up for the paperless billing. All right. So, since this is your first time here, who was your previous doctor? Did you have one? You did. Okay. Yes, we get a lot of, most of our new patients are people who moved. Right. Okay, so Dr. Feather. Right. And how many eye exams did you get from your doctor? She gave you quite a few. Okay. All right. Do you wear contacts? Yes. But you have your glasses with you. Can I take a look at them? In a moment. Let me just finish this. Okay. Allergies. Do you have any allergies, in particular to medication? Okay. And are you on any medication? Okay. All right. So I'm going to put this aside, and I actually would love to take a look at your glasses, if you don't mind. I'm just going to off your face. Okay. They're quite dusty. Can I get them a little clean for you? I don't mind. I can't stand seeing people with dirty glasses. We can clean them right up and you'll be able to see much better. That's our job here, to make you see better, isn't it? So we give it a few sprays on each side. And use this cloth. Try not to use just any old cloth you find lying around. You want these particular ones that won't buff or scratch your frames or the lenses. See, that's much better already. Okay. There we go. Dry off the paper. All right. Let me see. All right, you have a few scratches on the lens, but I managed to get most of the dust and dirt off, so here you go. Put those back on your head. Fantastic. All right. So I'll actually go ahead and give you, this is the sample size of our glasses cleaner and this rag, and I'll put that aside for you. Perfect. Okay. So let's start with some tests, shall we? And the first thing we're going to do is have you follow the tip of my pen. Can you see this all right? Would you prefer it if I used this? Okay. I know it could be a bit dark in here, so let's use this one. And what I'm going to do is I'm going to move the pen side to side, and I want you to follow it with just your eyes, okay? So you're going to keep your head facing forward, and you can start with your eyes trained on my nose, and now move your eyes to the pen, back to my nose, back to the pen. Okay. So your head doesn't move, but I want your eyes to follow this right here. All right? Here we go. Good. Good. Perfect. Okay. Good. Perfect. All right, a little closer. Okay. Good. Other way. Good. All right, now the pen is going to move up and down. Same thing. Keep your eye trained on the tip of the marker. Good. Perfect. Good. Good. Again, a little bit closer. Perfect. Good. Perfect. So you seem to do very well with both eyes open, but now I'm going to ask you to cover one eye. Okay? Yep, just with your hand. And we're going to do this again. Here we go. Follow the tip of the pen with your eyes. Good. Perfect. And then up, down. Okay, you can uncover this eye and cover this one. Alright, you know the drill. Fantastic. Very good. Very good. And perfect. Alright, you can uncover your eye. I'm going to be putting the pen very close to your nose and then back out again. Again, I want you to train your eye on the pen. Now, as it gets closer, you're going to have to focus a bit harder. But I'm just going to take a peek at how you do. Comes in and out. One more time. In, closer to your face, and out. Good. Alright. Again, close this eye. We'll do that again. In. Good. And out. And then the other eye, please. Thank you. In. And out. Fantastic. Alright. Now we're going to do a pretty similar test, but this is going to be with a light source. Alright? So I'm going to go back and forth again. Keep your head still. Keep your eyes on the light. This one's going to have a bit of a wacky pattern at the end, but we're going to start with the left to right, up to down, okay? You can use both eyes for this. Here we go. Good. Good. Right, a bit closer. Good. Perfect. Then the up to down. Alright. Very nice. Perfect. Good. Alright. So I'm going to start moving the light fairly rapidly. I want you to go ahead and focus when you can. Good. And keep your eye on the light. Perfect. Good job. A bit closer. Okay. Now I'm going to have you cover this eye, and I'm going to bring the light in and out. Okay? Here we go. Good. A little bright, I know. One more time. And out. Alright, now let's do the other eye. Same thing. Okay. Okay. Perfect. Now if you don't mind, I'm going to get a bit closer and I'm going to take a look at your pupils. So just look straight ahead, don't look at the light. Very good. Very good. And one more time. Perfect. Now let me do your other eye. Yep, keep looking straight ahead. Okay. Alright. Very good work. I know that light can be a bit bright, so hopefully that wasn't too uncomfortable for you. Your eyes look really good so far. But we are going to go through all the tests. So this next test is with my fingers. And what I'm going to do is move them out of your sight range, when you can't see them anymore, you're going to let me know. So for this one, you're not going to be following my fingers. You're going to be looking right at my nose, okay? So let's try one. Keep your eyes on my nose. Let me know when you can't see my fingers. Perfect. Very good. All right, you get it. So we're going to do that again. Good. Good. And I'm going to get a little bit closer. Right here. Okay. Good. And a little bit farther behind. I'm going to take a step back. Good. Okay. So we're going to go up and down now. Keep your eye on my nose. Keep your eye on my nose. Good. 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 Okay. So I'm going to ask you to cover this eye. And we're going to do the same thing, but my fingers are going to be moving. Okay? Same idea. Let's get started. Good. Good. Yes, make sure to wait until both fingers are out of range. Perfect. Okay. Okay. All right. You can uncover this eye and cover this one. Do the same thing. You're doing great. Perfect. Okay. Good. Okay. And right there. All right, go ahead and uncover that eye. And I'm going to ask you to once again look straight ahead. I'm going to be putting a couple fingers up, and I'm going to ask you to tell me how many fingers you see in your peripheral vision. So try not to look at them. I know it can be hard. Okay, here we go. Good. Good. 3. Another 3. 2. 2. 5. 1. 4. 3. 2. 5. 3. Very good. That is usually the one that people have trouble with. The easier test that we have is one that I'm going to test in your individual eye on. Let's go ahead and cover this one for now. So I'm going to move my hands, and then you let me know which finger I wiggle, either the left or the right. Okay? So keep this eye covered. And here we go. Very good. Nice. Got it. Okay. Good. Perfect. Good. Perfect. Keep your eyes straight ahead. Both. Very good job. And I'm going to have you cover your other eye for the same exercise. Okay. Good. Both. Very nice. Perfect. Good. Yep. Both. Fantastic. All right. So the last test is one that you're going to have to do with each individual eye. So you can go ahead and keep that eye covered. This is your typical eye chart. And this is a little preliminary test, but the doctor will be able to much more accurately assess what your prescription is. Okay. So let's start with the top here. E. Good job. Row 2. Very good. Alright, let's do row 3. Good job. Row 4. Perfect. Row 5. A little harder. Okay. Row 6. Can you do row 7? Very small. Okay. And let's hear your attempt for row 8. Don't worry if you get any of them incorrect. Can you make this one out? Good. And okay, not too bad. Alright. With your other eye, let's do the same test. We can skip down to, you can do 4 quite comfortably. Okay, let's start with 4, shall we? Very good. Row 5. Okay. Row 6. Good. Row 7. And row 8. Give it your best shot. Okay, very good. And yes, it's funny, sometimes when we do our better eye, it makes a big difference. Alright. Alright. So from eye to eye, it seems like you're pretty even. Do you know your prescription right now? Okay. And since this is your yearly, we'll of course have the doctor give you a full examination. Make sure you're up to date, especially if things have been looking blurry at all. So thank you so much for sitting through these tests. The doctor will be in shortly. It was nice to meet you. Alright, I hope to see you again soon.